Welcome to my channel. For women who are facing difficulties conceiving or have certain issues with their uterus, a TVS test may be recommended. Many women have questions and concerns when they are advised to undergo this test. What is a TVS test? Why is it done? Does it hurt? Are there any health risks? How much does it cost? There's nothing to be afraid of. In today's video, we will explain the TVS test in detail, InshaAllah. We will also discuss what kind of preparations you need to make before the test. So, let's begin. What is a TVS test? TVS stands for transvaginal ultrasound. It is a special type of ultrasound examination. In a regular abdominal ultrasound, a probe, a part of the ultrasound machine, is placed on the abdomen, which captures images of the internal organs using sound wave. These images are then analyzed by a doctor for diagnosis. However, in a TVS test, the probe is inserted into the vaginal canal to get clearer images of the uterus, ovaries, and nearby reproductive organs. Compared to abdominal ultrasound, TVS provides more detailed and accurate images, making it easier for doctors to make a diagnosis. Why is a TVS test done? 1. To check follicle size for conception. TVS is done to observe the size of the ovarian follicle. For ovulation or conception, the follicle usually needs to be at least 18 mm in diameter on days 12 to 14 of the menstrual cycle. It is also used to identify causes of infertility and to monitor IVF, in vitro fertilization, treatment. To confirm early pregnancy, when a urine test shows a positive result, a TVS may be performed to confirm the pregnancy and check the fetal condition. It can also be used to detect the baby's heartbeat early. To detect ovarian cysts or tumors, TVS helps in identifying the presence of any cysts or tumors in the ovary. To identify uterine issues, conditions like fibroids or other uterine abnormalities can also be diagnosed with a TVS. When should you do a TVS test? This depends on why you are taking the test. If it's for checking follicle size to conceive, it's typically done on the 12th to 14th day of your menstrual cycle. For other uterine issues, it can be done early in the menstrual cycle or at any time as advised. To detect fetal heartbeat, the test is generally done around the 5th or 6th week of pregnancy. Preparation before a TVS test. Here are a few simple preparations to make your test more comfortable. 1. Talk to your doctor. Be open with your doctor. If you have any medical conditions such as allergies or are taking any medications, let them know in advance. Wear comfortable clothing. There are no strict clothing requirements, but wearing loose and comfortable clothes is recommended to ease the procedure. Maintain personal hygiene. Clean your intimate area gently with lukewarm water before the test. Empty your bladder. It's best to urinate before the test so that the urinary bladder is empty. This helps produce clearer images of the reproductive organ. FAQs about TVS test. Do I need to be on an empty stomach for the TVS test? Not usually. TVS typically does not require fasting. However, in special cases, your doctor may advise otherwise. In general, doing it on an empty stomach can sometimes produce better results. Is the TVS test painful? No, it is not usually painful. The sonographer will apply gel to the ultrasound probe and gently insert it into your vaginal canal. You may feel some pressure, but it's not typically painful. How long does the test take? A TVS test usually takes 15 to 30 minutes, depending on your condition and the reason for the test. What happens after the test? You can resume your regular activities right after the test. There are usually no side effects. A few women may experience mild spotting or discomfort, which typically resolves within a few hours. Are there any risks associated with TVS? TVS is a safe procedure. In rare cases, slight injury or minor bleeding might occur due to the insertion of the probe, but such cases are very uncommon. How much does a TVS test cost? The cost of a TVS test varies depending on the diagnostic center or hospital and the doctor performing the test. Generally, it ranges from 1,500 Bangladeshi takas to 3,000 Bangladeshi takas. Is there an alternative to TVS? Yes, an abdominal ultrasound can be used as an alternative, but TVS usually provides clearer and more detailed images. Your doctor will determine which test is more suitable for you. How long does it take to get the results? In most cases, the results are available immediately. Sometimes, it may take 1 to 2 days depending on the diagnostic center. Is TVS safe during pregnancy? Yes. TVS is safe during pregnancy. It does not involve any radiation or harmful elements that could cause complication. If you have any questions regarding the test, always consult your doctor. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health related video. And remember to become a member of our family. Thank you for watching this video.